Hi, I'm Trish Seymour. I'm the Family Medicine Inpatient Sub-Internship Director, and I'm here to talk to you a little bit about how the Hospitalist Adult Medicine track differs from the FMIS track. It would make sense to watch the FMIS orientation video as well, although you've chosen to work on a non-resident team, which means you'll work directly with the hospitalist. Most of the roles and responsibilities of the sub-intern are the same, whether you're on the hospitalist only track or the FMIS track, but I'm going to outline some differences for you here. In terms of day-to-day schedule, hospitalist sign-out occurs every day at 7 a.m. in the Family Medicine Hospitalist office. Occasionally, that is a moving target based on what's happening overnight clinically and what time people get in, but it should certainly happen between 7 and 7:30 in the morning. You should be present for this sign-out. You are welcome to use my office, which you will be given a key to, which is the first left after you go through the locked doors on the Jakewith ground floor. There's no computer at the sub-intern desk, but that space is yours to use for the first of the month. So you certainly can bring in a laptop or a computer to work there. There's wireless isn't perfect in the hospital since we have to use the guest network and then sign in through the VDI. Keep the key for the remainder of the month so you can get in and out of the office even on the days that I'm not there. The Family Medicine Hospitalist office is far too cramped to have you leave your things there and work on one of those computer stations, but that is where you can go to find the attending that you're working with for the day. You are working with the attending that we call the non-teaching attending, and what that means is there's an assigned teaching attending working with the resident team, and then the Family Medicine Hospitalist non-teaching attending, or the second rounder, is caring for only patients that are not covered by residents, of which you'll have somewhere between 2 and 4, depending on the time in the month and how comfortable you are carrying patients. The Family Medicine Hospitalist non-teaching attending is always reachable by pager 4688. There's also a team cell phone number that you can get from them on the first day that is linked to their work cell phone. Most of us do stretches of somewhere between 5 and 7 days in a row, so you'll often work with the same person for multiple days of the week. Among their responsibilities, including covering patients that are not covered by residents, is conducting all of the nuclear cardiac stress testing in the hospital and the circumcision service. They do care for babies in the newborn nursery who have family medicine primary care doctors who don't come into the hospital. And so if you're interested in that, make sure you express that to the family medicine rounder that you're working with, because it's not typical for us to have you involved on those newborn patients, as this rotation focuses mostly on adult medicine patients. Every attending does the day-to-day activities on a little bit different schedule, but for the most part, after sign-out, we're doing cardiac stress testing somewhere between 8 and 10 in the morning. At that time, we're free to round with you. You should have pre-rounded on your patients, meaning looked at their vitals, labs, diagnostic studies, read the nursing notes, looked at CEWA scores overnight so that you're prepared to present formally. We do want to see some patients at the bedside with you because that's how we assess your comfort and ability talking to patients, but occasionally the day will be so busy that it is appropriate for you to see patients without us and then to do some version of sit rounding, but we don't want that to be the standard for your interactions with the attending. We do want you to have full intern level responsibilities, writing orders, conducting interviews, and creating discharge plans, working on discharge instructions, follow-up appointments, communication with the PCP, everything that goes into patient care. Really, you should think of the hospitalist you're working with as your teacher, but your backup for things you may have missed or forgotten. Please use the Blackboard system as you see fit. There's a sessions table with a list of clinical topics broken down by week. And I do not check the Blackboard site. It is strictly for your learning, but it is a great topic list. You should feel pretty comfortable with the topics listed on the Blackboard site by the end of the rotation. There are PowerPoints and readings affiliated with those topics as well on the Blackboard site. The other thing that's there is information about your project. You can choose one of 2 projects. The first is a 20 to 30 minute PowerPoint presentation about a clinical topic to be presented during the AM didactic sessions to the family medicine residents. The second project, if you choose as an alternative, you certainly don't have to do both, is creating a set of discharge instructions around a clinical diagnosis that you encountered over the course of the month. Please run these topics by me, because if one has recently or previously been done, I might steer you away from it in the interest of covering a wide breadth of clinical topics over the course of the year. Didactic sessions are 7:30 to 8:15 Monday through Friday in the resident room. Even when you're on at night, we ask that you stay to complete those didactics 45 minutes at the end of your shift. UMeds is a requirement by the medical school. I'm confident you'll see everything on the UMeds list, but please let me know if you have any difficulty checking those boxes off, and it's important that this gets done by the end of the rotation at the latest. Evaluations are done with me face-to-face at the mid-block and the end of block. You'll see the days delineated on your schedule. I don't always get a time ahead of time if I'm on clinically. It's a moving target based on what my clinical schedule looks like, but you will get a page or an email from me ahead of time at some point that day, letting you know when we should meet. I try to do it as early as possible. You'll have a concrete time if I'm not on clinical service then. Please look at the mid-block and end-of-block eval sheets on the Blackboard site, because there is a little bit of prep work, maybe 5 minutes tops, that you need to do to be prepared for those sessions. Tracy O'Donnell, who works on the Jaquith ground floor but is also available by global email, is in charge of housekeeping type things like making sure that your badges are up to date, directing you to the pager office if you need a new pager, parking, making sure you have access to the scrub machines, which dispenses scrubs for you on the times that you're overnight or weekends. You are allowed to wear scrubs. Otherwise, routine things like you need to bring your pager, your badge. You don't have to wear a white coat. You do need a stethoscope. In terms of computer access, as I said in the email, you need access to Salar, Sorian, Allscripts, Memorial Pulse Check, and the ImageCast system. Please find out if you have that access before asking me to request it. Oftentimes, sub-interns will think that they don't have Memorial Pulse Check, but they actually come to find out they do. They just needed their password reset. So call information IS 508-334-8800 to find out if you have access or not. If you don't, send me an email that includes the last 4 of your Social Security number so that I can get that access for you. It's a pretty quick turnaround time once we do that. It's a lot of information. The hospitalists are very used to working with residents, so they're a great resource if you have other questions, but I am always available by text message or by email, and both of them are acceptable mechanisms for communicating with me. My cell phone number is 774-364-0850.